But this paper has now been published, so I'm just really going to touch on that quite lightly and then also talk about some of the health economic data that we have, but it is quite preliminary at this stage. So I'm from the Diagnosis and Development team at the Murdoch Children's Research Institute. So one of the main overarching aims of our study is to understand natural history of the conditions that we work with. And so in order to do this, we do two formal assessments, so an intelligence or a developmental assessment. We also use the Autism Diagnostic Observation Schedule. So this is it's a commonly used standardized assessment for diagnosing autism, but it also gives a really good indication of social communication skills as well as repetitive and restricted interests and behaviours. Parents complete a questionnaire battery, so we do get developmental and medical history. Parents also complete the aberrant behaviour checklist, so this is a measure of maladaptive behaviours in individuals with intellectual disability. And there's been a utility index has been developed as part of this measure, which provides an indication of quality of life of the individual. As I said, we also collect health economics data, and then we do use two Prader-Willi syndrome specific questionnaires, so one on behaviour and one on mental health. We also do collect biological samples, so saliva, buccal epithelial cells, as well as venous blood, but I won't be talking about any of that data today. So the recruitment for this study so far, we've seen over 200 individuals, but this did start as a Fragile X syndrome study. So the majority of individuals we've seen as part of this study do have Fragile X syndrome, so it's 152. But we have also seen 35 individuals with Prader-Willi syndrome, 28 individuals with Angelman syndrome, and 13 individuals with chromosome 15 duplication syndrome. And this large enrichment into our study is primarily due to all the collaborations that we do have nationally. So lucky me, I get to travel around Australia and visit all the families. So recently I did a big trip in Perth and saw lots of families over there. So as I said, this paper has recently been published in the Journal of Neurodevelopmental Disorders, and it is in an open access journal, so you are able to go and read that paper yourselves. So I'll just give you a very brief summary of what is included in that. So we use the ADOS here to see how many individuals with Prader-Willi syndrome and Angelman syndrome met criteria for ASD just based on this assessment. And it's really important to note that when you are making a diagnosis of autism spectrum disorder, you would never just use one instrument. You would also be doing a developmental history. And so this is just an objective assessment of behaviour, usually lasts around 30 to 45 minutes with the individual being assessed. So we did find that about 72% of the individuals with Prader-Willi syndrome met the ADOS-2 criteria for autism spectrum disorder, and about half of the individuals with Angelman syndrome met criteria for ADOS, autism on the ADOS. And this difference wasn't significant between the two groups. When we looked at individual scores that make up the ADOS, so there's a measure of social communication skills, which is that social affect score there, and restricted and repetitive behaviours score. So we did find more symptoms or more difficulties with social communication skills in those with Prader-Willi syndrome compared to Angelman syndrome group. We didn't find any differences on the restricted and repetitive behaviour domain, but then when we did look at the specific items that load into this scale, we did find differences. So there was a higher prevalence of sensory seeking behaviours in the individuals with Prader-Willi syndrome, and these tended to be smelling items as well as feeling the textual elements of items as well. So just quick summary on this, we found significantly elevated rates of ASD in comparison to previous literature. And when we looked at the key items of the ADOS that kind of go into this diagnostic algorithm, we found atypical presentation on eye contact, there was a reduction in shared enjoyment with the examiner, and a reduction in the range of facial expressions. So I think it follows on quite nicely from Stuart's talk that maybe it's mental health issues, particularly depression, that is inflating the scores on the ADOS for those with Prader-Willi syndrome. And so more research should be done and should also include another assessment of autism before we can kind of really understand the true estimates of ASD. So the limitations, it's still a very small sample. So this was based on 25 individuals with Prader-Willi syndrome and 19 individuals with Angelman's. We had a very wide age range. So our youngest participant is around about 2 in this study, and the oldest is about 45. So we need further studies in larger independent national and international cohorts. But things to consider about this study is that the ADOS can provide a really good indication of social communication skills and strengths and difficulties, and this can be used to assist in early intervention planning. Also, if ASD is present, whether autism-specific interventions would be beneficial and provide reductions in maybe problematic behaviours such as the sensory seeking things, which might start to interfere with daytime functioning. And then also, if a dual diagnosis was made, does this increase access to funding? So I'm now going to talk about the health economics component of our study. This is very preliminary, so I was finishing the analyses on the flight up here. So we want to understand the economic cost of chromosome 15 imprinting disorders. So literature examining the economic cost of raising and caring for a child with intellectual disability has generally not taken into account the severity of the disorder, as well as the specific aspects of the condition. So we aim to extend on these findings by providing more in-depth clinical phenotyping with the objective assessments that we do, and this can give us a very good indication of the severity of the condition. We can also see if dual diagnoses, such as autism spectrum disorder and intellectual disability, whether they're increasing the costs of care. And then we also aim to explore the impact of different genetic subtypes on the presence of mosaicism and whether this increases health and economic costs. So we've used a modified version of the client service receipt inventory, and we updated this to reflect the Australian system, and this was done in consultation with key stakeholders with each of the conditions, including the Prader-Willi Syndrome Association of Australia. So it was hypothesised that increased severity in things like behavioural challenges, poorer intellectual functioning, and increased symptoms associated with ASD would be associated with increased costs to families and the health system. So this is now based on kind of the whole sample that we've seen so far, so 35 individuals with Prader-Willi syndrome. Again, you can see that very wide age range, so the youngest we've seen is 9 months all the way up to 45 years. We have a very wide range in cognitive abilities, but it again maps onto what Stuart was just saying before, that the majority of these individuals are falling into that mild intellectual disability range, with a very few kind of down in that more moderate range. And again, we do see quite a range in the autism spectrum symptoms, so the scale is from 1 to 10, and we see that full range there. In regards to the specific genetic subtypes, so about 51% of our sample have maternal UPD, about a quarter are deletion cases, and then we do have some of the other rarer subtypes, including some of those trisomy 15 maternal UPD mosaic cases we heard about this morning. So we did find that greater severity was associated with more costs and service use. This is all by parent report from the families. So 61% of families had accessed NDIS, and reasons for not accessing NDIS might be that it hadn't been rolled out in the area yet for the family that we saw. And access to NDIS was associated with poorer quality of life, so that utility index I was talking about from the aberrant behaviour checklist. So parents who thought their child had a poorer quality of life had accessed NDIS, and we also saw an increase in use of allied health professionals from those families who had accessed NDIS. When we looked at home modifications, about a third of families had made modifications to their homes, and those families who had made modifications to their home, not surprisingly, we did see more food-seeking behaviours in those families who reported that. There was more oppositional behaviours and just more overall Prader-Willi syndrome specific behaviours. So that's from the Prader-Willi behaviour questionnaire. And again, that poorer quality of life measure. Those families who purchased equipment, so about 2/3 of families had purchased equipment for the care of their child. And again, this was associated with poorer quality of life, more purchasing of equipment. And the two main things that we saw were locks and incontinence products. So again, probably not so surprising. So I also just had a quick look at some other things. So we found that older age was associated with more oppositional behaviours and more bodily related behaviours and more Prader-Willi syndrome behaviours in general. We also saw more social communication difficulties in our older participants. And again, this might just be because of the increased prevalence of mental health issues that are occurring with age. Not surprisingly, the majority of our younger participants were taking growth hormone, and we did see a more service use with allied health professionals in this cohort. We didn't find growth hormone to be associated with reductions in challenging behaviours or intellectual functioning, but it was associated with less communication difficulties. I just did some quick further analyses, and it's once I kind of took out the I guess what I'm trying to say is growth hormone actually didn't really have an effect on social communication difficulties. It was really just the age, so that these difficulties are increasing over the time, regardless of whether growth hormone is being used. So greater severity, particularly Prader-Willi syndrome specific behaviours, were associated with greater costs and service use. Parent reports of quality of life were consistently associated with health economic factors. Behavioural challenges appear to become more severe with age, but as Stuart said, maybe they taper off about after 30. And age was a better predictor of social communication difficulties than growth hormone use. So we still have quite a bit of work to do with our health economic data. So we want to look at relationships with our molecular measures that we've collected, but also to link to health records such as Medicare and Centrelink, and also determine the implications for the health system when a diagnosis is made earlier. So recruitment for our study is still ongoing, so if you'd like to get involved, you can contact myself, or if you're in New South Wales and ACT, you can contact our genetic counsellor, Carolyn Rogers. I'd like to thank all our funding bodies, and of course all the families that have participated so far for their valuable contribution, and all our national and international collaborators. And thank you for your attention.
Thank you. Look, I'm afraid we're going to have to move on to the next talk because we're running a little bit late.